Hello, everyone. This week's featured topic in Capital Insights is the Medicare Doc Fix. So, Matt, for those who don't know what the Medicare Doc Fix is and why it's important, what's your quickest summary?
Yeah, so this has been the top advocacy priority for physician advocacy organizations. It refers to a 2.83% reduction in Medicare payments to physicians that took effect on January 1st of this year. Physicians organizations have been fighting hard to get that cut eliminated before the beginning of the year, but that was not included in the December continuing resolution that Congress passed, which meant that the cut took effect in January. And ever since, many organizations have been fighting really hard to try to get that cut fixed for the rest of the year.
And so, why are we talking about it specifically this week?
Well, this week was the week where the government funding was set to expire, and the bill that Congress passed or still needs to pass that will extend federal funding was expected to serve as the legislative vehicle for the doc fix. And unfortunately, the doc fix was not included in the continuing resolution that the House passed earlier in the week. That CR now is waiting further action by the Senate. And while there is still a little bit of politics going on where it's unclear exactly if it will pass, we still think that it ultimately will, but it doesn't look like the doc fix is going to get added in when it ultimately does pass.
I see. And so, what does this mean? What do you think long term will be? How will Congress handle this issue? Do you think that Doc Fix will be addressed eventually in some other package?
Yeah, I think it's important to understand that the reason the doc fix hasn't been included has nothing to do with the doc fix itself. It's not like there are representatives or senators who are opposed to the doc fix and are fighting against including it. Really, what's happening is House Republican leadership in particular is trying to pass clean versions of spending bills. So, bills that don't include various other policy riders. Now, typically, Congress relies on these spending bills to serve as the legislative vehicle for lots of other things that don't quite get enough attention for a standalone vote. So, by departing from that norm and passing clean spending bills, Congress basically is just losing out on the opportunity to pass policies such as the doc fix, which is why we're at where we are today. Now, the champions in Congress for this policy, the ones who are really leading the charge on this, have said that they are now shifting their attention to including the doc fix in the budget and reconciliation bill, which House and Senate Republicans are expected to use to advance much of their legislative agenda over the coming months. So that's really the next opportunity that we're looking for. The exact timing of when the reconciliation bill will be passed is still uncertain, which could mean we have to wait several more months before we see that 2.83% reduction addressed. But my view is, with higher risk potentially comes higher reward. There's been also talk, in addition to fixing the 2.83% reduction, to also passing a more sustainable fix for Medicare physician payments, which have historically been lagging behind inflation to the point where the difference between inflation and updates to the Medicare physician fee schedule conversion factor have deferred by over 20% since 2010. So, in addition to fixing the 2.83% reduction, many advocacy organizations have also been fighting for a more sustainable inflationary update that would be applied to Medicare payments every year. And I think that the reconciliation bill could potentially serve as an opportunity to get not just the 2.83% cut addressed, but to also add the inflationary update as well, because the main barrier to historically has been finding a spending offset for the inflationary update. And given the wide range of spending cuts that we're expecting to see in a reconciliation bill, we could potentially use that to identify an offset for a more sustainable inflationary update to Medicare payments. Of course, some of those offsets include things like reductions to Medicaid, which means you're kind of giving money to the right pocket, taking it out of the left pocket. But that's not to say that's definitely what's going to happen. there's a lot of ways that Congress could go in terms of offsets, but I think the thing to understand is, again, like I said, with higher risk potentially comes a higher reward. Where waiting for the doc fix could also mean that we see the inflationary update that we've been fighting for as well.
Well, thank you for that, Matt. I would encourage everyone to, if they want to learn more, to read Capital Insights this week and every week on Friday when we release it. Thank you.
Thanks, everyone.